I've got an important update to share on 1 year's progress on the Licensing and Credentialing Champions Challenge we've been running at the Dr. Lorna Breen Heroes Foundation. As you know, the Dr. Lorna Breen Heroes Foundation's mission is to safeguard the professional well-being and job satisfaction of our healthcare workers, focusing on reducing their burnout and improving their overall job satisfaction. We envision a world where seeking mental health care is viewed as a sign of strength among our healthcare workers. In 2023, we launched an all-in Champions Challenge for licensing and credentialing, both at the state licensing level and the hospital credentialing level, to remove overly intrusive questions which appear on applications either for state licensing or hospital credentialing. These overly invasive mental health questions ask applicants about prior mental health diagnosis and treatment, and often violate the Americans with Disabilities Act. We have made great strides in 2023 to advance this work. We launched our Champions Challenge in November of 2022. Since that time, we have issued not only a joint statement with NIOSH in May of 2023, but also a joint campaign entitled Impact Wellbeing, which is disseminating the resources that you've just now seen. We've helped to change state law in Virginia, which applies to all licensed healthcare workers. All 500,000 licensed healthcare workers now are free from having to worry about overly invasive questions on their application or renewal application for state licensing. 67% of the hospitals in Virginia are now through our challenge, starting from a baseline a year ago of 0 hospitals that were compliant with our recommendations, and that number is growing every day. So much so that well over 50,000 of our healthcare professionals are no longer burdened by these questions at a local level at the hospitals that they work. A little bit more about this national campaign we have launched with CDC and NIOSH entitled Impact Wellbeing. What you can see before you are 3 activations that they're recommending that hospital leaders take. Right in the middle is using the toolkit that we have published on our website to remove overly invasive questions at a hospital credentialing level. Here's the list of our 2023 Hospital Champions Challenge recipients. You can see from that list it's beyond Virginia, and that list is growing every day. We encourage everyone to use the toolkit that you'll have access to at the end of these slides and make sure that you are removing these questions at a local and state level. Now, here's a little bit of an update on the state licensing. What you can see is where we were in November of 2022. At that time, 19 states were compliant with our recommendations on licensing questions for medical licensing. Just less than a year later, we now have the majority of states through our 3-step process and 10 more actively working on it for medical licensing. We know that this change is possible, as you can see from how quickly licensing boards have acted on medical licensing. I wish I could say the same for nursing licensing progress on this issue, but just this past fall, we have published a new study which only identifies 13 states as potentially compliant with our recommendations. I say partially complete because we still need all 3 forms from each and every state licensing board in order to award our badge, and we would encourage you to make sure that your state licensing board for nursing licensing supplies us with all 3 documents. Now, if you'd like to download our toolkit, please use this QR code. It will give you full access to our 3-step process, including our communications platform as well. Now, for those doctors and nurses out there, doctors, your QR code's on the left side of the screen. Nurses, your QR code's on the right side of the screen. I would encourage you to use that QR code and send an email to your state licensing board and ask them to make sure that they use our 3-part toolkit. Remove these questions, communicate these changes to the workforce. You are entitled to know what the rules are, and you are entitled to the same mental health access as your patients. Thank you for locking arms with our foundation and helping to advance this important work.